But just because you affect and improve the structural integrity of a joint doesn't mean that miraculously those compensatory movement patterns or dysfunctional firing patterns just get better.
I'm Garrett Salpeter, and I believe that the most powerful and transformative way to help people recover from pain and injury, heal from trauma, and reach their highest levels of fitness and performance is to focus on the nervous system. In this podcast, we'll share knowledge from the frontiers of neuroscience and inspirational stories of how applying that knowledge has empowered people from all walks of life to heal, adapt, and grow. Welcome to this episode of the Undercurrent podcast. I am joined today by Michelle Harris, physical therapist and co-founder of CHARM here in Austin, Texas. It's an acronym, stands for Center for Healing and Regenerative Medicine.
Right.
Thank you so much for being here.
My honor.
I am very excited to talk with you today, Michelle, and hear a lot about what you're doing at CHARM, because you have a very compelling mix of physical therapy, regenerative medicine, and we definitely want to dive into that. Before, however, we get into that, can you tell us, please, a little bit about your career progression and where you started? I know, you've taken a few different turns along the way. Yeah,
a couple little turns that kind of figure to be obvious when they're seen in retrospect. So I was a competitive gymnast, both in my youth and through college. Mm-hmm. And so I knew pretty early on that I wanted to be a physical therapist. And so as a gymnast, I was like, oh, well, I'm going to be a sports medicine physical therapist because that's what I've seen. And as I worked through PT school, I realized that that wasn't near as interesting as my long rotation, which was in neuro, a rehab. It was a rehab center down in Corpus Christi. And so I quickly, very early on, got an appreciation that everything's neuro. Mm. And so that's really the backbone of my entering into PT. I took my first position that I stayed at for 10 years at St. David's Rehabilitation Center here in Austin, and was on their spinal cord injury team and their brain injury team, saw some strokes and saw some orthopedics. So you're kind of comprehensive rehab. And gravitated towards spinal cord injury. Mm-hmm. Was adjunct faculty member at Texas State for longer than I'd like to admit, and taught their spinal cord injury unit. Awesome. And then also during those years in the 90s, I worked as an instructor and trainer for Medtronic Neurological in their movement disorder division. Mm-hmm. And so that again was very neuro-based and very movement disorder-based. And that kind of led those years of my life. And once that was over and we started having kids, I guess I missed a spot where David entered my life. David Harris entered my life as he's a physical medicine and rehab doc. And so we've known each other since the 90s as well. And then the next stage was just working in complex rehab equipment. And mm-hmm. so that led itself to really kind of a foundation of accessibility and autonomy for people with really complex rehab needs. Mm-hmm. But it's the backbone.
That's awesome. So you have this very rich foundation of experience in the neuro world. And then through that, you connected with your now husband, mm-hmm. Dr. David Harris. So if we say Dr. Dave, that's who we're referring to. Yeah. Co-founder also with you of CHARM. Mm-hmm. And tell us, please, then next, what was the process, or how did you come to start this new clinic together?
Yeah, it was a lot. It was a lot of years. I mean, through the 90s and through the early 2000s, we were kind of seemingly on different paths. Mm-hmm. And it's funny looking back now because it's like we had these vows in our wedding that were like two ships kind of going side by side to the same destination. We didn't realize it. It was like, oh my God, wow. That came true. That's so weird. But CHARM was that destination, and we really didn't ever
Wow.
think we would be in practice together, because
That's powerful.
It seemed like I
The
was
wedding vows did it. It's like a
Yeah, I
self-fulfilling
know.
prophecy.
yeah, and there was this cool other part about not being bound together, but
Mm-hmm.
instead stepped side by side, so you didn't bounce into each other and destroy each other. It was actually kind of cool.
That's cool.
Yeah.
That's beautiful. Wow.
Anyway, we didn't realize that we were even traveling the same direction. But round about 2008, 9, we were like, gosh, if we're ever gonna start something together, this is the time. The boys were getting a little older. I was looking for the next thing. And all of this time, since the mid-90s, Dr. Dave had been a pioneer, educator, and innovator in regenerative medicine. So we knew that was his part of charm, but what was my part? And so that neuro piece just laid the groundwork for what charm became. And the name and the logo all are really, really symbolic, because, healing had to be in the name. Regenerative medicine had to be in the name. But we really, at the foundation, there's a foundational truth, right? That the body does the healing. The doctor doesn't do the healing, and the therapist doesn't do the healing, but your body does the healing. And so that had to be in the name. And then, the logo shows that mix of structure and function, which is the groundwork of what charm brings together.
That's awesome. And I love how, you say everything is neuro, and how you work that in a place where people come, primarily regenerative medicine, they're coming to regrow cartilage or
Right.
help with more structural challenges, and you're helping them with a very functional neurological approach. So I love how you've been able to blend that. Let's dive into that a little bit now too. So one of the tools that you use is the NeuRac. And I know when we first met, we talked a lot about it. You told me about what you've been doing with it. It definitely piqued my interest, because you seem to be working through a very similar neurological lens. And can you talk about that and what it does and how you implement it into your practice?
Yeah. I mean, it was kind of one of those things where there was a gap, right? So we get a very diverse population at Charm. We get a lot of people who have been in pain a long time. We get a lot of people who maybe had surgery and are still in pain. We have a lot of people with just degenerative joint disease or a nasty tear that they'd really like to not, or to avoid surgery. And so the structure piece, like you said, is just that, the regenerative medicine. But just because you affect and improve the structural integrity of a joint doesn't mean that miraculously those compensatory movement patterns or dysfunctional firing patterns just get better. Certainly a stable joint is required for that, and that structural piece is really important. But many times the neurological and neuromuscular dysfunction is what led to the degenerative joint disease or that tear to begin with. And so just because you fix that structure doesn't mean that it goes away. And there was a gap because I couldn't, in a lot of our patients, I just couldn't decrease that global muscle upregulation. I couldn't tease away the compensatory movement patterns with just what I had with my hands and some pieces of equipment and some other neuromuscularly based therapy strategies. And I seriously was sitting at my kitchen table Googling closed kinetic chain therapy, body weight therapy, and the research on the NeuRac popped up. And what it is a closed chain suspension therapy, much like a TRX, but it has the ability to offload the body at numerous points so that you can decrease that global muscle compensation, get somebody completely out of pain, and still work through a closed chain suspension exercise. And that was important because you need that multi-segmental control, right? So when you're working through a closed chain, to get something done, you have to stabilize everything upstream and downstream from that point of closed chain contact in order to make something happen. But I couldn't do it effectively without offloading the body. yeah, I stalked them for some time and read all their research. They're based in Norway. And so it's not a huge thing here in the United States. But after stalking them, I realized, this is that missing link between, yes, I've got the osteoligamentous structure now from the regenerative medicine, but I've got to reprogram the neuromuscular system and the brain in a situation that's pain-free and offloaded enough where the person can be successful.
That's awesome. So the offloading is, in a gravity-based environment, normal day-to-day activity, a lot of times those compensatory patterns are so built in that someone, if someone's having to shift onto one leg or you're rotated in a certain position or something like that to get enough leverage or mechanical advantage to just move, then they, just the gravity and their body weight can be too much to force them to do that. So you're able to get them in a position where they can relearn these kind of component pieces, learn it in that safe and controlled environment, and then incorporate it back into the next time they meet gravity. Yeah.
And the other thing about the red cord is that it's very diagnostic. So when you're looking at a person, you see the compensation, but you don't necessarily know where the dysfunction is. And what's been really cool is that, 85% of the time, if you've got right gluteal pain, the dysfunction is actually on the left side. And you can see it in the ropes because there's no place to hide. You, as a therapist, you can quickly see where that dysfunction is happening, where the weak link is the way Neurak puts it, where the weak link is residing, and then offload the body so you get the right muscle at the right time and in the right amount firing, and then you just take away the help. And so, because I'm a very impatient person, this therapy hit it because it's not like reps and sets. That's why I didn't go into sports medicine, by the way, because I was like, oh my gosh, no. And so it's not reps and sets. It's not do more to get muscles stronger. It's like a light switch. You're changing the neurological piece of the neuromuscular control, and it's a very input-based system.
So hearing you speak about this now, and when we met a couple of years ago, I was intrigued because we even use similar terminologies. Definitely have a similar perspective. So with that, you've been using that in your practice when we met, almost 8 to 10 years?
Since 2011 is when I did.
So when you had been using it for 7 years or so, 6 or 7 years when we met, and getting good outcomes. And on the PT side, we'll talk a little bit about regenerative side too, but on the PT side, you've got the Neurak in place. So if people hear the term red cord or Neurak, the red cord is like a scaled down version. The Neurak is the more medical therapeutic grade version, right? Is that? Yeah.
It's kind of fun. Again, it goes back to its Norwegian roots. There's a Norwegian term, den rodtråden, which literally translates as red cord. And the reason why they say den rodtråden is because it has to do with, and it's a Chinese thing too, it has to do with that invisible red thread that runs between everyone who's basically destined to meet, is what the Chinese version of it is. It's this invisible red thread that, you're destined to meet somebody. It doesn't matter, time, place, circumstance, you are going to meet them. And even though it might be stretched or tangled, it's never broken and you will meet that person. So, but anyway.
That's kind of cool.
It is cool.
Yeah.
It's kind of like those vows. No.
Yeah, that's right.
But the concept of red cord is kind of like that. It's that thing that connects rehab, injury, rehabilitation to active lifestyle and fitness to optimal performance. And so you go from being really offloaded and nurturing those proper movement patterns to more active, taking off all that help to, a big percent of, I know the Norwegians, but also a lot of Asia, the Olympic teams in Asia use red cord as training tools for their athletes. So it has that cord through it that, brings that together.
I've also shared with you a couple of the Major League Baseball teams that we've worked with have red cords in there too. So just so everyone can visualize it, it's basically a series of literal cords suspended from the ceiling that you as the patient would be lying on the table, and it would suspend part of your body to offload, like Michelle was talking about, offload part of the body. So I mean, you can Google it or find an image of it, but it's this series of literal cords that suspend from the ceiling.
Yeah.
And you can do some really precise movement patterns with it.
Yeah.
So you've been using this in your practice by the time we met for 6-7 years, getting very good outcomes with it. What made you interested in the possibility of bringing in a Neubie?
Yeah, I think, well, like the red cord, I stalked you for a number of years too. And, I was really looking at, was there another gap? Was there another gap that red cord wasn't filling to the potential that I wanted it to? Was there more diagnostically that we could do? And really it just took really understanding it as best I could, that the Neubie could give me more information than I could with just the testing in the red cord. And then as I got to know and understand NeuFit in my infancy here still, but the ability to scan the body and again see where aspects of the body were resistant or fearful of thresholds, or just fearful of loading, because that's exactly what we see in the red cord is that if there's that fear in loading, that's when you have to offload them. But with the Neubie, just seeing how you could scan the body and really, again, very disparate areas of the body are involved. And it was just so synergistic to the work in the red cord that I just felt like there was another gap there that we could fill, and more information on where the dysfunction was actually at. And then, be able to apply directly to that dysfunction as you worked in the cords, that it was just, once I understood enough about the Neubie and the NeuFit method, it just seemed like a no-brainer that was the next gap that we needed to try to fill. There's a piece that we haven't really talked about though, and that's that sympathetic upregulation piece, because that's another piece in the red cord NeuRac method that's huge. We talk about these kinetic chains of motion, but before that is that neutral zone local motor control piece, and down regulating everything enough to be able to get to that deeper stabilizer system. And the NeuFit again fit into that hole as well, where there's a big piece of sympathetic down regulation and the ability to address that with some of our patients who just have complex needs, long-term chronic pain, and anything that you can help peel that onion is going to be beneficial.
That's awesome. And that was another one of these kind of shared talking points or similar foundational concepts that were guiding the kind of our operating systems. Yeah. And so another very point of connection.
If you're ready to supercharge your practice, listen to this. Garrett and Team NeuFit have just released a new online course entitled Introduction to the NeuFit Method. In this detailed 8-hour course, you'll gain mastery of the fundamental techniques in our practice, including muscle testing and activations, nerve glides, and joint articulations. You'll also get introduced to our patented direct current stimulation device, the Neubie, an incredible machine that's empowered professionals just like you to help their patients heal, adapt, and grow faster than they ever thought possible. To learn more, go to www.neu.fit/learn. And now back to the show.
So now that you've implemented the Neubie, you've had it in there for about a year now?
No, just December.
Okay.
January.
Okay.
Yeah.
So 3/4 of almost 3/4 of a year. Yeah.
There's a few months in there too.
Are there
Only
any?
I was using it
That's
because
right.
of COVID.
That's right.
I got pretty good at those.
That's right. Yeah, that's
That
great.
helped actually to have some time just with it
Yeah.
and me.
So since you've been using it then, are there any interesting outcomes or particular patients or scenarios that come to mind where it's been particularly impactful?
Wow. That's a really loaded question. I think again, the sympathetic downregulation piece has been pretty profound. Since our patient population is, I think by definition, because there's pain involved, and at times there's been long-term pain involved, there's sympathetic upregulation involved. And that alone has been very helpful. Yeah, it's really interesting stuff, sleeping better, my digestion's better. I mean, all of these strange things that people can barely put their finger on, but know that they want to do it when they come back in. Don't take that piece away. And it's like, okay, 10 minutes. The other piece is just the ability to scan and be very, very precise with where we're going to put the electrodes to load this system during the activities, whether we're on the NEURAC or not, has been super helpful. And we just, the NEURAC brings with it very rapid change at times. And I feel like the Neubie has just taken that up a notch or two. And the other piece is the ability to just lengthen and relax those muscles. Whereas working in the red cord does make people more relaxed because you're getting the right neuromuscular input and the right coordination. And people will step off of there with feeling, oh my gosh, my hip is so much looser. Yeah. But the combination, again, has just been, it's just a really powerful combination. And again, it's the diagnostic in addition to the therapeutic benefit of it. The other piece is we have a big population of EDS patients. It was so funny that you mentioned that on the mastermind call, because it's like, we have so many EDS patients in our practice.
Just for everyone listening, Ehlers-Danlos syndrome.
Ehlers-Danlos is a hypermobility of the connective tissue, which it just screams, I need regenerative medicine, right? Because it's white tissue and it needs to be more stable. But it's also because, by definition, this individual's connective tissue is unstable. We want to try to make that neuromuscular system more stable.
All the more important.
Yeah. And I have had such good results with the EDS population. Mostly young girls, it seems like, have EDS. They tend to be really beautiful dancers and really good swimmers and just have connective tissue that's super duper laxed. But with laxed connective tissue, you then have a neuromuscular system that's trying to basically hold you together. And so the combination of using the Neubie to kind of relax where we want certain muscles to relax, but then use it to just truly improve the neuromuscular tone around really laxed joints has been very interesting. And again, I'm just like learning every day on how to use it better.
And that's one of the things that we've talked a fair bit about is for those of you listening who don't have a Neubie, you can manipulate certain settings on there to preferentially, relax or reset tone, and then in different settings to create more tension in certain areas. And so you've been able to use that strategically in those places and that type of thing.
Yeah, I'm starting to become strategic with that. I mean, I truly feel very new, but that's part of the fun. I mean, I feel like a kid again because it's like, oh my gosh, I can do this. And it's just that excitement of just figuring something else out.
Yeah. That's awesome. Very good. Can we talk for a moment about, just to give everyone who's listening who may not know all of the intricacies or just, can you give a little bit of an overview on regenerative medicine and kind of the other piece that you're doing there at Charm? And we've had several patients who we've worked with here at NeuFit on the functional side, and we find that we can't quite get all the way there, and so that these structural interventions are helpful. And so we've had people that we've referred across town to see you, to work with Dr. Dave, to do these wonderful regenerative injections. Can you just give everyone a little bit of an overview of regenerative medicine and the suite of services that you offer there at Charm?
Sure. Yeah. And when, in reality, the regenerative medicine piece of Charm is the larger piece of
Sure.
Charm. Regenerative medicine, people may have heard things like Prolotherapy or PRP. When you use the term Prolotherapy, it's like the overarching concept of regenerative medicine. Prolotherapy stands for proliferation therapy, right? So you're proliferating the body to basically mount a new inflammatory process. I always tell people, I always use the ankle sprain as an example because it's easy. So you sprain your ankle, it goes through this inflammatory process, and over a set of months, you have the inflammatory, then you have this, and you have the remodeling, and you have this healing process. At the end of that, your body's kind of done. And you may still have a really unstable ankle, which you probably will roll again. And then then you've got a new inflammatory process, and you heal that up. But connective tissue it's not contractile, so it doesn't necessarily heal up like it used to be. If there's tears there is chronic instability there. And if you just think about that, then you've got physical therapy and the functional side, and you've got surgery.
Yeah.
Well, regenerative medicine,
there's got to be
let's talk gaps, right? So regenerative medicine is this humongous gap filler in which you can use injectables like dextrose solution all the way up to somebody's platelet-rich plasma or bone marrow aspirate concentrate, which are different biologics that we use in the same fashion of regenerative medicine. And basically you just take it and you inject all of the different connective tissues around the joint.
You take it out of the patient's body, so it's their own stuff.
Yes, yeah. So in the realm of PRP, you draw the blood, we process it in the lab, you get this platelet-rich plasma. It's basically, if you just did the dextrose solution, let's say you did basic prolotherapy, your body's going to bring in the army to take care of that new injury, that new inflammatory response. And then it's going to do its normal healing response, which in and of itself is just super cool because you're using the body's own natural healing process. You just have to clear the barriers of stagnation and jumpstart it again. But with something like PRP, you bring the army already to the war. So you get in there, you inject the area, you already have the platelet-rich plasma right there, and they're just ready to do their job because it's right there. But really, the sequence of the body using that is the same in both. And you take it up another notch to use the bone marrow and the stem cells that are taken from bone marrow aspirate concentrate. And then and we use that always in addition to PRP. We never use stem cells, and you'll hear it around a lot of places, stem cell this and stem cell that. Be careful, because you want to make sure that it's in a regenerative medicine process, and we always use PRP in addition to that stem cell work. And you're just going to utilize the different aspects of regenerative medicine depending on what you're looking at. If it's a really degenerative joint, you've got lots of cartilage damage, and you're really trying to stave off a total knee replacement, you might go for the bone marrow plus the PRP. If it's just a really floppy joint, you might just do prolotherapy. If it's a medial meniscus tear or rotator cuff tear, you might go PRP so that it's really specific to that tear and to the whole joint integrity. One of the really cool things, because again, all of those are meant to mount an inflammatory process and put the body back into a healing cascade for those particular connective tissues. But now we've got this, we're further refining that into not using the platelets so that you get an inflammatory process, but actually just lysating those platelets. So you don't have the inflammatory process anymore, but you still have all of the healing aspects of those biologics. And that's called platelet lysate. And the platelet lysate can be used around nerves where you don't necessarily want an inflammatory process, but you want that healing that those biologics can produce for the body. So,
the soldiers, but not the battle.
Exactly. Yeah, something like that. Different soldiers. I'm sure they're women because they're anti-inflammatory right now. I don't know. But different soldiers.
Yeah.
And it doesn't inflame the area. Actually is
It's like the Army Corps of Engineers instead of the battalion or something.
Some different troop there. But it actually has an anti-inflammatory response. So you can do it around a herniated disc. To not only help, like an epidural steroid, right, would decrease the inflammation around that herniated disc and free up that nerve root so you're not having pain down your leg anymore. But if you do platelet lysate, not only do you anti-inflame the area, so you're not having that compression down that nerve root anymore, but also you're putting in more of a regenerative process around that nerve. So if there's been any damage to that nerve root because of that compression, now we've got that nerve root healing better as well. So that's a really exciting piece of regenerative medicine.
That's awesome. Thank you for that overview. That's excellent. And I think you said it best, at least in terms of my kind of perspective, where, there's, functional physical therapy and some of the things that we've been talking about. And then and the other end of the spectrum is surgery. And it's like, there's got to be something in between, and there is. And I'll speak to my own experience that I became a patient of Charm after getting to know you and Dr. Dave, and I had some hip, torn some cartilage in my hip, and I have made significant progress in managing it and restoring function, doing our own stuff, doing NeuFit over the years, and yet when I really push it, if I'm really sprinting hard, or if I'm out on the ice playing hockey again, it'll be sore. And so I became a patient a few months ago and did the bone marrow treatment. Took the bone marrow out of my pelvis, had it injected into the hip capsule, and it's made a difference. It's better. So I can speak, from my experience, and as I said, we've had several mutual patients who have had very, very positive outcomes there as well. So if anyone listening here wants to learn more about you, look up Charm. Can you let them know, website, social media, where's the best place to connect with you and your team?
The website's good. It has a lot of information on, how those pieces of structure and function, but specifically on the regenerative side, that need to really stabilize that joint and improve that connective tissue integrity. It's simple. www.charmaustin is the website.
Charmaustin.com.
Charmaustin.com. And lots of studies on there that you can refer to, and it lays out our regenerative medicine procedures that we talked about, but also interventional pain. All of our docs also do epidural steroids and joint injections as well. But it's the difference between relieving pain and truly repairing injury.
Yes.
So that's the difference. We can relieve pain in lots of different ways, and that's super important. As we know, in the neuromuscular control of things, you're never going to have neuromuscular control of something if there's pain present, and
it's like
and vice versa.
Chicken or the egg.
The chicken or the egg, is the pain because of the input issues, and that would take another hour. But I totally agree with all of that. The regenerative medicine is more of truly repairing injury and resolving that pain rather than just relieving it.
I love the proof of concept that you've shown how powerful of a combination it can be to do these regenerative practices and have this neuromuscular based physical therapy, and how powerful that combination can be, how it leads to excellent outcomes, and really has differentiated you and set your clinic apart, certainly in the Central Texas area here. And I've know people who have come in to see you from other states, even other countries.
So, we got that map in the. It still surprises me. It still surprises me that there isn't more of putting that obvious structure and function under one roof. we obviously do it all the time. Physicians refer to physical therapists. Physical therapists, we need the surgeons and the regenerative medicine. We need each other.
Yeah.
And I am surprised that it hasn't happened more often. But
well, you're leading the charge. So if you do want to check them out, remember www.charmaustin.com.
Yeah.
And thank you so much, Michelle.
Thank you.
We do. I guess we do these.
Yeah.
The knuckle bumps.
The knuckle bumps. Yeah.
In this COVID world.
Yeah. Well, it's just, I just want to say really quickly how much the relationship between forward-thinking clinicians, Austin is kind of a mecca in that way, I think.
Mm-hmm.
And we have such cool forward-thinking clinicians, doctors, therapists, trainers in this city that, it's just a real honor to work together and keep moving it forward. It's a lot of fun.
We feel the same way, and you and your team are prime examples. We love working with you and your therapists on your team and the doctors, and it's all good. So so if you're listening, come to Austin.
Yeah.
Not only that, there's really good barbecue.
There is definitely good barbecue.
Yeah. Awesome. Thank you so much for being here.
Thanks, Garrett.
And it's been an absolute pleasure. Another episode of the Undercurrent Podcast. Thank you so much for listening to the Undercurrent Podcast. If you enjoyed this episode, please consider leaving a review and be sure to subscribe to stay up to date as we release future episodes.